Hey guys, welcome to my YouTube channel. In today's class, we are going to learn about the chapter Infection Control in the subject Nursing Foundation of Nursing. So, infection control. Now, first of all, we must learn the basic terms for infection control. First one is disinfection. Disinfection is the process of eliminating pathogenic organism on an inanimate object with the exception of spores. The inanimate object means the object that does not move, like non-living things like floor, wall, table, but not on human body. So disinfection is a process of eliminating pathogenic organism on an inanimate object with the exception of spores. That means that spores does not get eliminated while using disinfectant. The next term is disinfectant. The disinfectant is a chemical substance that is used for disinfection on an inanimate object. So this disinfectant is a chemical substance that is used for disinfection. So the examples for disinfectant are phenol and chlorine. Now the next thing is antiseptic solution. Antiseptic solution, it is a substance that is used on a person's skin to inhibit the growth and activity of microorganisms, but not necessarily destroy them. So the thing that we use on our body is known as antiseptic solution, and the thing that to kill the pathogen that we use on floor and other inanimate objects are known as disinfectant. The thing that we use in our body is known as antiseptic solution. So this substance is used on a person's skin to inhibit the growth and activity of microorganisms. Yeah, it does inhibit the growth and activity of microorganisms, but there is no sure of killing them. Contamination. Contamination is a process by which something is rendered unclear or unsterile. What is contamination? Contamination is a process of adding dangerous things or bad things to a good thing. The process of which something is rendered unclear or unsterile. When something is unclear or unsterile, it is contaminated. So, in nursing, contamination means that unsterile or unclear. So, if it is clear and sterile condition, it won't be called as contamination. The next thing is infection. Infection is an invasion of body tissue by pathogenic microorganism. Infection is the invasion of the body tissue by pathogenic microorganism. We all know that infection is the invasion of microorganism into a person's body. The next thing is carriers. What are carriers? We might be a carrier. An animal might be a carrier. Everyone can be a carrier. The carriers are peoples or animals that does not show any symptoms of illness, but that they have pathogen on or in their body that can be transferred to others. So carriers are peoples or animals. They actually have disease but does not show any symptom. As they don't show any symptom, people won't know they have that kind of disease. So they would take the disease inside their body or outside their body, and they would let it transfer to other peoples. So these are known as carriers. Let's see the nosocomial infection. Do you know what is nosocomial infection? It is easy. It is the infection that is acquired from hospital setting. Hospital acquired infection. It is an infection acquired from healthcare setting. Not only hospital, any healthcare setting. It may be endogenous infection when the parts of the client's flora become altered and an overgrowth result. It becomes endogenous when the client's flora become altered and an overgrowth result. So nosocomial infection are the infection that are acquired by a person from a hospital setting. Now we can study about pathogens. The pathogens are divided into two: resident pathogen and transient pathogen. So what are resident pathogen? These are the pathogen that are normally present on our skin, but they can't be easily removed unless certain friction is applied. We know that while washing hands, there are many ways of washing hands to make it clean. We have to apply pressure, we have to wash our hands harder by creating friction between two hands. So, resident pathogen, these are organisms normally present on our skin and are not easily removed by hand washing unless considerable friction is used. So, here we need to use friction to remove the organism. So, what is transient pathogen? Transient pathogen are the normal pathogen that are seen on our skin, which can be removed easily by hand washing, but no friction is required there. These are microorganisms attached to skin when a person comes in contact with another during normal activity of living and easily removed by hand washing. So resident pathogen cannot be easily removed by hand washing, but the transient pathogen could easily removed by hand washing. Concurrent disinfection. Concurrent disinfection is the day-to-day disinfection. These are practices that are done on a day-to-day basis in the care of patient and his immediate environment to limit or control spread of microorganisms. Concurrent disinfection are done on a day-to-day basis in care of the patient and his environment. That means the patient and his room. So the cleaning process that are done on a person's room and himself on a day-to-day basis, and why it is done to limit or control spread of microorganism. Yeah, this is done to limit and control the spread of microorganism. Asepsis. What is asepsis? Asepsis is a state of being free from disease causing microorganism. If a place is in asepsis, if you said that your room is asepsis, then there would be no microorganism there. I mean disease causing microorganism. So in a hospital room, if a patient's room is to be asepsis, then there would be no disease causing microorganism. So asepsis is a state of being free from disease causing microorganism such as pathogenic bacteria, viruses, pathogenic fungi, and parasites. The term often refers to those practices used to promote or induce asepsis in an operative field of surgery or medicine to prevent infection. Yeah, this asepsis is done to prevent infection. These are done on mainly on a surgical room. Sepsis. Sepsis is just the opposite of asepsis. Sepsis is a clinical condition where a person has a systemic reaction to a bacterial infection from a localized infection in one part of the body, such as wound or infected tooth. If a person gets infection from a hospital due to the systemic reaction to a bacterial infection from a localized infection and having a wound or infected tooth, and that would cause the entire body to pain. So to get this sepsis, I would recommend you to by heart it, because its definition is not giving any logic sense. Sterile technique. Sterile technique is a technique that is used to make a room asepsis. So if you want to make a room asepsis, you must do or practice and proceed and do some procedures and make the equipment and area free from all microorganisms and maintain sterility. So, sterile technique is a set of specific practices and procedures performed to make equipment and area free from all microorganisms and spores and to maintain the sterility. So that is it for today. This is the first part of the video, and the second part would be updated by tomorrow. So thank you for watching this video.